The growth and development of any state or country depends largely on its people. Indeed, the interrelationship between man and material resources go beyond merely transforming materials into wealth. Since wealth is not an end in itself, so it is incumbent on man to sustain the creation and recreation of wealth for the growth and sustenance of society. As a catalyst for developmental process, therefore, man, in his wisdom and capacity, possesses the wherewithal to bring necessary changes to bear on the society he lives in. This is why the extent of development of any society is mostly measured in terms of the quality of its man resources. The strong link between man and material resources is similar to that between wealth and health, and this link is aptly captured in the popular saying, "Health is wealth." But central to this too is man. Since man is responsible for the development of his society, the idea is that for him to create wealth, he must be healthy. Therefore, man's ability to sustain his productive capacity, which then translates into the development of society, rests squarely on sound health. It thus goes that for a society to develop, it must, as a matter of necessity, provide qualitative healthcare delivery for its man resources, or simply put, the populace. In Lagos State, the attention and focus healthcare delivery has enjoyed and continue to enjoy, no doubt speaks volumes of the importance that is attached to this sector. Ever before the creation of the state in 1967, healthcare delivery to those responsible for the administration of this geographical entity was given priority attention. As a matter of fact, the establishment of today's General Hospital Lagos is a reflection of not only their commitment, but also foresight and the knowledge of the interrelationship between health and development. The establishment of this hospital, therefore, was to provide the necessary avenue to offer required health care services to Lagosians. Without doubt, not many Lagosians, particularly those that have either worked or received medical attention in this health institution, would doubt its contributions to the economy. Odon, as it is preferentially called due to its proximity to the race course, a popular center for sporting activities, has contributed enormously to the emergence of the city of Lagos, not only as the industrial and commercial capital of Nigeria, but also as the most urbanized cosmopolitan city in the entire West African sub-region. As the first and foremost health institution in the state, this hospital continues to enjoy considerable attention of successive governments in the state. To be precise, this attention has been committed and varied. Before 1999, government support and patronage was noticeably recorded in the specialized but restricted departments. As a result, as improvements were noticed in one department, others were left with little or no attention. With the administration of Asiwaju Bola Ahmed Tinubu, however, this approach was not only radically changed for the General Hospital Lagos today, but it has risen to the needs of the present generation. Having declared its unwavering and passionate commitment to the provision of qualitative and affordable healthcare delivery to its citizens, the present administration in the Lagos State Healthcare Delivery Program, spearheaded by the unassuming Commissioner for Health, Dr. Leke Peter, with the able assistance and support of the ministry's permanent secretary, Dr. Jide Idris, recognized General Hospital Lagos as an indispensable institution for the implementation of its healthcare programs. As a result, a comprehensive rehabilitation program was not only earmarked for the institution. At the end, the general operational environment was upgraded to provide this hospital with clean, beautiful and attractive scenery a hospital of its class deserved.
Attention has been given not just to this hospital but to the health sector by this government. The governor, as you know, believes in the fact that health is wealth, believes in the fact that one of the surest ways of touching the lives of the people, particularly the poor masses, is through the health sector. And more importantly, as an administration, we believe that after payment of our salaries, the rest of the money belongs to the people. So we must spend it on them to make sure they are not only alive but they are well. So with that in mind, you can understand why
where their relations were. They did not know that the person had an accident and was in our ward here for almost a month before they now came later on to pay up for the admission bill and also to thank us for having taken care of the patient. Definitely, if Lasambos had not been there and nobody had been able to pick that patient, anything could have happened. But because Lasambos was there to be there on time, they brought the patient to our last sense, which is our emergency section, and the patient who has been was given treatment in our ward, was admitted and was being treated until the relations actually came forward to see him. And we have such cases, we have many of such cases almost on a daily basis. Most times when you come to our ward, you find patients who have been road traffic accident victims who are yet to have their relations to come forward to see them, identify them, and then actually assist in their treatment.
This unit of the hospital is complemented by the theater, which is equipped with ultra-modern operational facilities for easy and hitch-free operations, a well-stocked blood bank, and ultra-modern ambulance buses which facilitate the hospital's responses to medical emergencies. Similarly, the General Hospital Lagos is staffed with capable hands in the country's health sector. Thus, the hospital, through its committed medical team, continues to provide the necessary and needed care and attention its patients require.
Democratic administration, we have achieved a lot with the assistance of the state government in terms of the money they give us every month, the monthly running cost. It has helped us a lot to improve on our infrastructure. Like if you were here maybe 3 years ago, you see how dilapidated the structure is in general. But now, as you can see now, you can go around the hospital, including the wards. We have painted, we have introduced so many new things into the hospital environment, and this makes our patients to be more relaxed, and they are happy to come to the hospital and get treated. In terms of staff, we have benefited from employment of doctors, nurses, hospital attendants, and different cadres of staff, and that has also helped to improve on our patients' care. Also, in terms of staff welfare, a lot of things have been beneficial to all our staff, like in terms of exemptions. The staff are happy now to come to work because They know when they are sick. They can be seen by the doctor, and then the drugs they prescribe for them, they will get exempted for it. And if they require admission, they only pay for diet. Every other thing is free, including their families, 4 children and their husband or wife.
The way of approach at times, is what used to cause the clashes between the nurses and the patients, and that has been improved. And nurses are now being educational wise, they are on specialty areas, not just doing general nursing and midwifery alone. Like in the emergency room now, you have the nurses, after doing the general nursing, midwifery, they are specialized on accidents and emergencies. We have those that specialize in theater area. We have those that specialize in anesthesia area. Those that specialize in ophthalmic, which is the eye area. Those that specialize in orthopedic area. The ENT too, we have nurses specializing in this area. And when you are specialized in the area, you put an extra touch to that care that you do.
Although this may seem like a personal assessment, but for anyone that has had one thing or the other to do with this hospital in recent times, it will be noted that there is a clear difference and marked improvement in its operations now compared to what obtained in the past.
I just feel Governor Tinubu is doing a great job for the children per se, and I believe he has the heart of the children at heart.
Nice. The patients are, the nurses are nice. They are caring. They are okay.
Not only the nurses, others in the services. Are you well taken care of? Are you giving food on time, drugs?
Yes. They give us food, 3 square meals, and the drugs on time.
Obviously, it is reassuring and encouraging that the General Hospital Lagos is now living up to its famed status as a foremost health institution. With the strong support and funding from the present administration of Asiwaju Bola Ahmed Tinubu through the professional advice rendered by the State Ministry of Health, supported by Health Management Board, this hospital has gradually and steadily cultivated a culture of excellence through its professional expertise in its areas of focus. The present condition of the hospital, therefore, underscores this administration's dogged commitment to breaking new grounds in public administration. Again, it shows that the consistency, commitment, and the belief of the present administration in the health sector is largely in the interest of the populace. It therefore behoves the people to exploit the potentials of this institution for their health needs so that they can contribute their quota to the overall development of Lagos State and Nigeria. As stated at the beginning, this administration has avowed through its several commitments, policies and actions that preventive health care can be conveniently administered and brought to the doorsteps of the masses. creation of Lagos State in 1967 was no doubt a result of several developments. Apart from the need to halt the secession bid, it could be asserted that the clamor and agitation that preceded 1967 made the creation truly necessary. Lagosians, making use of every opportunity available, put forward to government valid points to convince it of the need to establish the state. It would be recalled that one of the strongest points canvassed for its creation was its viability. As argued, the proximity of the state to the sea, including being the seat of the federal government, were important factors that would guarantee its viability. The picture of Lagos State today not only reflects this four-sided argument. The state, by all indices of development, has proved to be viable. Although seated on just 3,577 square kilometers, Lagos State, the smallest in the Federation, hosts about 15 million people, thus making it the state with the largest population in Nigeria. Attaining such a record increase in population did not just occur. This state, since its creation, has gradually but steadily emerged as the nation's industrial and commercial capital. With about 65% of Nigeria's industries concentrated here, while being a major point of exchange for goods and services, the position of the state as Nigeria's economic base is not in doubt. However, one major issue that is associated with this economic potential through the jump in population figures is urban planning and physical development. For most parts of the state, lack of physical planning and development control has given birth to many sprawling urban settlements, which today constitute a big problem to the state's developmental process. Indeed, such settlements as Ajegunle, Badia, Makoko, with their teeming populations, not only represent the failure of past governments to recognize the importance of town planning, they equally constitute black spots on whatever efforts are being made presently to replan Lagos. Without doubt, this situation is not new to Lagos State Urban and Regional Planning Board. In view of the expediency and paramount importance of the situation, the authority has focused considerable attention not only on curbing illegal developments, but also on pre-development planning. As a first step in this direction, the board embarked on a review of Lagos Metropolitan Master Plan and Lagos Regional Master Plan after more than 20 years of expiration. This singular exercise afforded the board the chance to update the extent of physical development in the state, while it brought within the new master plan new settlements which were not covered by the expired master plan. At the same time, it gave the organization a strong lens with which physical developments in the state can be monitored. This done, the authority embarked on a strong advocacy campaign to sensitize the entire Lagos public on the need to obtain approval before development. Indeed, the authority recognized the extreme importance and inherent benefits embedded in carrying the people along in its work. Through its participatory approach to planning, therefore, several informative seminars and meetings have been hosted with community development committees, CDCs, community development associations, CDAs, traditional rulers and their representatives, local government officials, as well as other stakeholders in the building industry in virtually all the 5 administrative divisions of Lagos State.
Because the intention is actually to sensitize members of the public. So we've been able to achieve that.
What
what will be the next line of action, sir? Most certainly to still toe the line of dialogue for another couple of weeks, so as to see that people start to submit, layouts, especially for the excised villages, and start to submit building plan applications, and then see how to advise them as to the need to protect the right of ways for drainage alignments, road alignments, utilities alignments, and so on and so forth. It is only after that that we intend to actually move out, because largely Badagry division is a largely semi-urban and rural areas, so we cannot apply the same kind of hard note. We want to give another 2 weeks for it to settle down into them.
Furthermore, the number of local planning offices under the authority's control was further expanded to bring its services closer to the people. Indeed, this step resulted from the complaints often received by the authority regarding the distance of planning offices to the people, and one of the major reasons why people find it difficult to go to such offices for relevant information and approval. Besides this, the Urban Regional Planning Board commenced the implementation of its Operation 3030 policy, an initiative aimed at processing building approvals within 30 days, provided all necessary documents are submitted. Since implementation, this step has helped in reducing the number of reported cases of illegal developments to the barest minimum. Having achieved an appreciable level of success in this area, another significant initiative came into operation via the reorganization of its monitoring departments. Under the present situation, the board's monitoring ability and capability have improved tremendously, bringing into focus such areas which were hitherto left unattended. One of such areas is the state's river embankment. For a significant period in the past, developments along the state's coastline received little or no attention, giving the people living along this coastal belt an unhindered opportunity to perpetrate environmentally unfriendly and selfish activities. With this new approach to monitoring, therefore, the authority is already being confronted with startling revelations of these illegal activities, particularly those that border on illegal land excavation.
So what is happening? Don't go inside.
Don't go.
Don't go inside. Don't go. You need not go inside. I don't.
As you can see, a couple of young people have made it a habit to excavate their land embankment separating the lagoon from the Atlantic Ocean. This situation is so threatening as it is presently and leaves the divider at less than 3 meters. Knowing the effects of an Atlantic surge and its attendant consequences, this grim picture no doubt portends danger not only to the perpetrators but also to entire communities living along the coastline belt.
Most certainly we'll write our report and we should move in within the next 2 weeks to stop that. We'll see that they are virtually getting from the Badagry Creek, they are virtually getting to incur into the Atlantic Ocean. So we have to stop that at the earliest possible time. We are about to be attacked at one of the sites. So we have to effect arrest, put a permanent stop to it, and that's why I had to, with my team, see the Obakran of Badagry, with a view to arranging for a meeting which should hold by Thursday next week, with a view to educating the populace as to the dangers inherent in the activities of the illegal sand diggers.
More often than not, the board, about to become Lagos State Physical Development Authority, has adopted demolition as a last resort. Painful as it is, and with the accompanied losses not only of the properties demolished, but also through the cost of demolishing such structures, the authority has had to set off its enforcement role to bring sanity into physical development in the state. Unfortunate and sad also, it is disturbing that in spite of its strong and expanded monitoring and advocacy activities, unapproved and illegal structures still abound in the state's landscape. Either in residential, commercial, mixed development, or along major roads, these unwholesome activities hold regulation guiding physical development in great contempt, and it will be agreed that demolition of such structures is indispensable.
It's because of the excessive proliferation of these illegal structures in the last quarter of last year. In fact, starting from about July, it became so embarrassing and, disturbing. And it was like we were not working at all. That's what informed it.
Is it a sign of things to come in the year?
Most certainly, because